Yeah, so good afternoon all. Thank you for coming and thank you for everyone who's online as well. I have the responsibility today to introduce our guest speaker, Dr. Omnia Omrani, from Imperial College London. Probably I'll need an hour or so to go through all the accomplishments and awards that's on the list, but I'll try and do justice with my brief introduction. So Dr. Omni is a medical doctor by trade and has held multiple roles as a commissioner at the Lancet Commissions on sustainable healthcare, prevention of viral spillover, and post-COVID population health. She is currently a climate and health policy fellow at the Imperial College London with over 7 years of experience in climate change, health, policy research, and education. She has been working in developing strategies and solutions at the intersection of planetary health, climate justice, and intergenerational equity to unlock systematic change for health and prosperity. She was the first official youth envoy for the president of COP27. She was then appointed as the health envoy for the 28th UN Climate Conference and was an associate at the Women's Leaders for Planetary Health and a member of the Global Youth Coalition for Road Safety. So thank you so much for finding time. It's very busy schedule to give us your talk. And yeah, the floor is yours, and I'm sure we'll find your talk very interesting.
Thank you. So yeah, good morning everyone. Thank you so much for joining the talk, both people online and in person. And I would like to give you a little bit perspective around the intersection between climate change and human health. I've been reading a lot about the amazing work that you are all doing, and I think, and I hope this will be very relevant to the work you're doing around sustainability, sustainable infrastructure, and built environment, and so on. But before I start, I would love to share a bit of story around how I personally started working on climate change and health. So I started as a medical student back in 2017. And when I was selected to do an emergency medicine training in Hialeah Hospital in Florida, and during my second weekend, there was Hurricane Irma. And it was the first time for me to see how a climate-related disaster directly impacts the health of the communities and the patients that we were working with. And that climate change is not just an environmental health issue, it is a human health catastrophe that is impacting the most vulnerable. And I saw firsthand patients who were directly injured by the hurricane debris, those who were experiencing anxiety and stress because of the power outages, those who needed urgent medical care but couldn't get it because of the road blockages. And in the aftermath, many people presented with infectious diseases because of the outbreak of infectious diseases that happened in the hurricane shelters after Irma moved to the next state. So this gives me a brief introduction to how the conversation around climate change and health started. It wasn't many years ago, it was actually in 2015 when the Lancet Commission on Health and Climate Change announced that, and they concluded that climate change is the single biggest threat to global health of the 21st century. And then a few years after, they decided to understand how climate change is also the biggest health opportunity of this century. So when we talk about the impacts of climate change on human health, the first ones that, especially in the UK, many news outlets are talking about, reports, academic institutions, is the impact of heat directly on the health of communities, whether it causes heat stress and leads to a diversity of diseases, kidney diseases, but also cardiovascular diseases because of the increasing temperature, up to increased morbidity and mortality, especially in the elderly population. And then the second impact is around the extreme climate-related disasters. In the UK, we've seen many floods, but also around the world, we've seen hurricanes, typhoons, wildfires, and this leads to direct injuries, but also to morbidities, loss of lives, loss of homes, and loss of loved ones. And then the second thing and the most important very important is air pollution, and air pollution led so far to the death of 7 million people every year, either directly by respiratory diseases or cardiovascular diseases, particularly in children who are experiencing asthma at a very high rate, more than any time before. As a physician myself, it was every day when I was seeing tens of children presenting with asthma exacerbations, pneumonia, and lung infections because of the high levels of air pollution in Cairo. And then we also see the heat is also impacting the vector capacity. So now vectors are either increasing in their capacity, carrying more infectious diseases to countries where it was already eradicated, for example, malaria, but we can also see the rise of infectious diseases in other countries, like we have seen last year in France with the outbreak of dengue virus. And then also increased allergens. Many of us are experiencing this now because of the rise of allergens and pollens, and it is also increasing asthma and respiratory diseases. But also water and food insecurity, which is one of the biggest impacts of climate change. Malnutrition and diarrheal diseases, particularly in children, is going to be the leading cause of death that is driven by climate change, and this was announced this year by the Intergovernmental Panel on Climate Change report, which showed that malnutrition and diarrhea are so critical. Food and water insecurity and environmental degradation in general is causing mass migration, forced migration, but also climate-related disasters is leading to conflict and migration, whether internal or migration or displacement outside of own countries. And more importantly, which is the hidden but now talked about, is the mental health impacts of climate change. And I will take you a little bit in depth and what that means. But before that, climate change is compounding not only health directly, but all the determinants of health, whether it is the access to food and water, and we can see rising levels of food and water insecurity disproportionately around the world in regions more than others. We can also see conflict, rise of forced migration driven by climate change, but also disrupted access to education and healthcare services. And this is a report that UNICEF has produced last year, announcing that over 40 million children every year do not have access to education, or education is disrupted, either because of climate-related disasters or because climate change is causing illnesses in children, making them unable to go to schools. But also climate change, as you can see when it comes to food insecurity, this is one of the biggest Lancet countdown reports that focuses on health and climate change. So in 2015, they started as a commission, a group of scientists trying to understand how does climate change affect health. But because of the wide range of impacts, the commission became an entire team that monitors the impact of climate change on health every year. They have 41 indicators, over 200 academic and research institutions around the world that are monitoring how does climate change affect health directly and indirectly. This is from their 2023 report, and it shows now comparing to 1980 to 2010, the rate of heat waves and drought has been increasing, and it led to 127 million people around the world suffering from severe food insecurity, and this is only in 2021. But also the rate of heat-related mortality has increased by 85% in elderly aged 65 and older, and this is in comparison between 2002 to 2022. And as you can see how it is also disproportionately impacted where countries in Africa and the Caribbean and also in Central America are being affected by heat-related mortality, as well as in Europe and the UK as well. But also heat leads to mortality, and it also impacts labor capacity. Many of the workers, particularly in the agricultural and the construction sector, are now facing decreased labor capacity because of the heat. And this, when it is quantified according to percentage of GDP, can reach up to $860 billion lost capacity in 2022. And then we talked about air pollution, and a very interesting number that WHO came up with this year is that we know that 7 million people are dying every year because of air pollution. Now this number has increased to 8, but almost 2 million of them are because of fossil fuel driven air pollution, and they were able to do that directly. And as you can see that also household air pollution, which is another issue that is also disproportionately impacting the health of women because of lack of clean cooking facilities, and household air pollution has led to 140 million per 100,000 deaths of people, which also means the 1.9 million population. And then finally, when it comes to the increase in vectors, so this has been seen particularly in malaria and other infectious diseases. And as you can see from the graph, the vector capacity has been increasing, and it has been compared to 1960, and the capacity increased by over 30%, both for Aedes aegypti and Aedes albopictus, which is both for malaria. And then there is also the injustice of how the health of people is being affected by climate change. So there is the injustice in terms of geographic, both global north and global south, but also in terms of generation. And a report that was produced in 2021 showed that the children who was born in 2020 are going to experience up to 7 times the rate of extreme weather events and climate-related disasters compared to their grandparents. And this interesting projection was done by the IPCC report last year, because they've seen how many young people are being disproportionately affected, and they compared a child who was born in 2020 compared to a person who was born in 1950, and they are going to experience under the 1.5 degree scenario, which means when the temperature increases by 1.5, they're going to experience 4 times, and this can rise up to 7 times by 2100 of climate-related disasters that young people right now are going to experience. But also there is the awareness of the climate crisis and the perception of how young people are disproportionately affected. We are going to shoulder the impacts of climate change, even though we are not the ones causing the emissions that are leading to it. And a survey of 10,000 young people in 10 countries showed that 70% of them are worried about climate change, are experiencing climate anxiety or eco-anxiety, and more than 40% said that this worry and this anxiety is affecting their daily life function. And it is driven by their awareness of the climate crisis, but also the media that is amplifying. And this is actually 2 weeks ago, the UN climate chief said we only have 2 years to save the planet, but also a very recent study that was last year, right before the UN climate summit in Dubai, BBC and Google, BBC analyzed Google searches around climate anxiety, and they saw that it increased by 27 times in the last 6 months alone. So talking a bit more about the mental health impacts of climate change. So people who are experiencing first-hand climate-related disasters are also experiencing directly the anxiety, as well as post-traumatic stress disorder and depression. And this is how mental health is directly affected, but also indirectly when we see these climate-related disasters or extreme heat, which leads to crop failure, loss of income, and loss of lives and loss of society cohesion. This also leads to increased rates of substance use, which we have seen among farmers, increased rates of suicide, which we've also seen across agricultural workers because they are losing their income, their source of income, and their land. Many indigenous communities are losing their land because of environmental degradation. They are experiencing something called solastalgia, which means that they are worried about the land, which is part of their own identity. But also children and young people are experiencing climate anxiety, and also known as generational trauma, because of the impacts that they are seeing, but they are not put in a position to influence the decisions that are being made. But there's also the increased impact of heat on people who are living with mental health challenges. If physicians do not adjust the dose of the medication that they're taking, their body will not be able to adapt to the increasing temperature. So also considering the health of people who are living with mental health challenges in the society. And at the same time, one of the biggest drivers of climate anxiety is government inaction, which you can see right now. And this was a very interesting analysis looking into the commitments and the strategies that oil and gas companies are putting. And it has actually increased by 173% in terms of their commitment to further expansion, further use and production of fossil fuel. And 78% of the countries assessed by the Lancet Countdown, their subsidies have actually increased and reached up to 305 billion. And at the global level, the International Monetary Fund has calculated the rate of subsidies to fossil fuel, which has increased last year alone from 4 to 7%, which means 7 trillion US dollars are being given as subsidies to further expansion of fossil fuel companies. But on the other hand, I feel like very doom and gloom, but on the other hand, when it comes to renewable energy and the renewable energy sector, the rate of investment, but also employment has increased by 12.7 million new jobs were created in the renewable energy sector. And at the same time, the lending for the country's lending and supporting for and banks lending for renewable energy has also increased exponentially and is about to be equal to the rate of lending giving to fossil fuel companies. But most importantly, we need to, especially people who are working in the climate space, like yourselves and like many others, our state of mind, our own mental health and resilience is dependent and very important to be able to drive climate action. And we cannot just bear the burden of despair of the climate crisis, but we also need to invest in our own mental health and resilience to be able to do the work that we're doing to lead climate action, to lead climate adaptation and mitigation solutions. So our state of mind impacts the state of the world. And also, when it comes to health and climate change, it has been so interesting to see how scientific journals that are looking into the impact and looking into promoting the research that links health with climate change across all sectors, whether the infrastructure sectors, whether cities, mitigation, energy, transport. The number of publications has increased 3 times from 2012 to 2022. So in 10 years alone, it has increased by the triple. And there has been a very interesting report, and that was published last year by the London School of Tropical Medicine and Hygiene. They were looking into the concept of health co-benefits. So there are the health impacts that we need to understand, but to every climate solution, there are co-benefits to the health of the population. And they were able to quantify over 6,900 records and scientific papers to see which climate solutions have the biggest health co-benefits and these benefits can be amplified to further increase buy-in and interest in these climate solutions. So in this report, which you can find, it just got published right before COP in December, but the decarbonization of the generation of electricity has proven to have the most climate impact or climate benefits or carbon emission reduction, but it also brings large health benefits by reducing air pollution, which reduces respiratory diseases, and it also reduces morbidity and mortality that is driven by air pollution. It also improves mental health and well-being because of having cleaner air and better access to healthcare services. Clean cooking stoves, which is now a very politically interesting solution. And actually this month, there is going to be the Clean Cooking Oil Summit in Paris, where many heads of states are going to come in to commit and to buy into this solution. And this has significant health benefits, not as much climate benefits as, for example, the decarbonization of electricity, but it also has amazing health benefits, especially for household air pollution. Actions to improve diet has also improved the biggest health benefits, and this solution has had most of the research around it because from all the global studies, and it has a very good potential in reducing carbon emissions. And last but not least, this is one of the biggest win-win actions when it comes to active transport, because it improves health, it reduces obesity, improves mental health and well-being, but at the same time, it also reduces carbon emissions from a transport sector perspective, as well as reducing the use of private cars by switching to cycling, and it also improves individual pro-environmental behavior. But very interesting, in 2023, so last year, the end of it, a study looked into how investing in mental health and resilience by reducing air pollution, addressing climate hazards, and increasing access to green spaces. This can reduce costs of mental health care services up to $47 billion every year by 2030, and this number can grow to $537 billion every year by 2050. So also investing in climate solutions can reduce the cost of mental health care services sought by the community. So recently, WHO has been focusing a lot on the work around cities and how cities can offer a great leader when it comes to action towards health and climate change. Because in the modeling that WHO did in 2021, they showed that people who are living in cities, each one of us is going to face an increased rate of heart diseases, lung diseases, stroke, and other stresses because of the high levels of air pollution. In 2021, they also did a survey across a set of global cities, and more than 50% of them said that climate change is going to compromise their public health infrastructure, and their healthcare systems are not resilient to be able to cope with the impacts of climate change. And with the global increase of temperature, 2 degrees, now we are reaching that by 2050, at least 800 million people are going to be exposed to rising sea levels as well as the climate-related disasters that we are seeing right now. However, cities also offer solutions, and these are just a few examples from a report that was recently published by the Wellcome Trust and aimed to really get philanthropic interest in investing in health and climate change. And one of the solutions that they proposed is looking into technological advances for air conditioning and refrigeration, which the need is expected to triple by 2050. But if we do that in a way that is sustainable, that is not polluting, and that is energy efficient, that can help increase or bridge the cooling access gap, which also relates to the mortalities related to heat. And at the same time, we can do that without increasing carbon emissions. So this is one of the solutions, for example, the Rocky Mountain Institute is doing around their carbon-free buildings initiative. Another interesting and important intervention is around monitoring the health of workers during heat. And the Environmental Defense Fund is looking into the correlation between how does heat affect or lead to chronic kidney diseases in construction workers, and looking at interventions that would help address that would help protect them from heat, putting in interventions in terms of schedules, when the workers can work and when they should not work during high levels of heat, and protecting them in other ways, but really looking into the health of construction workers during extreme heat. Another important sector is actually the health sector. So this is part of the work that I've been involved in with the Lancet Commission, which started last year, and we're looking into how healthcare facilities can be sustainable and environment friendly, as well as climate resilient, because the health sector is the first line responder or the first line of defense when it comes to the health impacts of climate change, and physicians are going to be the ones responding to the impacts. So if physicians themselves need to be aware and need to be trained to address the health impacts of climate change, but also the infrastructures of the health sector, which now contributes to less than 5% of global carbon emissions. The health sector itself, there are many ways by which the health sector can be more environment friendly. So a few examples of that would be looking at the energy efficiency of healthcare facilities. We know that the OR, the operating room, is the most energy intensive, but also looking on the use of anesthetic gases. There are anesthetic gas alternatives that have less carbon footprint and would not compromise the health of the patient. So transitioning into that, looking into waste reduction in healthcare facilities, which has the highest amount of waste. And looking at how this can also, looking at the maintenance of healthcare equipment, can also help with reducing costs, and these costs can actually be redirected to improve patient care and to provide better healthcare equipment and services to the patient. So it is a win-win scenario for healthcare facilities, but there's so much data measurement and also need for having more multidisciplinary interaction between the healthcare facilities, the leadership at the healthcare facilities, and the infrastructure, as well as the sustainable community to implement that. And there has been an interesting analysis looking into as well the early warning systems in healthcare facilities. And many countries have been working on integrating health in their climate plans and doing that in terms of having early warning systems that can predict climate-related disasters or extreme heat and be able to are able to have healthcare facilities ready for these impacts. But it was a bit distressing that mental health had the least, so only 8 out of 84 countries consider the mental health impacts of climate change and actually preparing for it. And one of the things that I've also worked on and wanted to share with you is integrating climate change and sustainability in the curricula of healthcare professionals. And after I experienced witnessing a hurricane, I was very motivated to go back to my country in Egypt and to learn about climate change in my curriculum, but there was no mention whatsoever about climate change, even though it is my responsibility as a physician to understand that. So together with a group of medical students across 112 countries, we were able to ask whether climate change was part of the curriculum or not, and less than 12% had a mention of climate change, which means that more than 80% of the health workforce have no idea about the climate crisis. And we were able to work with amazing educators, professors, institutions to integrate climate change in 5 countries across all their national curriculum. And it's also important not just for health curriculum, but also for universities and faculties across all disciplines and sectors. And then the last thing I also wanted to share is how the health community is not just working, so we're not just focusing on our education and our healthcare facilities, our workplace, we're also looking at our role as messengers and health advocates in the climate negotiations. And for many years, healthcare professionals, doctors, nurses, and physicians were going to the UN Climate Summit to really bring urgency that the negotiations are about the health of the communities the most vulnerable. And this year has been incredible because, as you can see, that this year had the highest number of health actors. So we started from maybe 50 to 100 healthcare professionals coming to the climate change conference in Glasgow in the UK. It had the highest, and for the first time there was a dedicated space for health and climate change in the summit. But then this number exponentially grew to 2,000 healthcare representatives going to COP, advocating and pushing for the narrative around health and climate change, that these negotiators are negotiating the health of the population, and it's important for health to be centered at the heart of these discussions. And for the first time, a declaration was made in the UAE on climate and health that was endorsed by 150 countries. Ministers of health came to the climate change conference for the first time. Over 49 ministers were there. They presented their plans around climate change and health. And $1 billion in funding was dedicated solely for health and climate change across all the different aspects, whether it's extreme heat, infectious diseases, mental health, and so on. And speaking of mental health, this is the project and the last thing I also wanted to share with you. So I'm based at Imperial College, and we are the first center to work on the interlinkages between climate change and mental health in the UK. And we were funded by Wellcome Trust to do a global study to understand how does climate change affect mental health across all the regions, and to create agenda for researchers, policymakers, and academic institutions to have a set of research priorities as well as policy priorities around climate change and mental health, and to bring both fields together. So we did a set of 21 dialogues across all 7 regions. We brought in climate scientists and experts, both research and policy experts, together with psychologists and psychiatrists. Each region had 2 dialogues around research and policy, and through that we generated a set of research agendas. So you can see right now we have 870 experts. Sorry. Yeah. So we had 870 experts from 80 plus countries. They participated in our dialogues in each region, and we made sure that the dialogues were in different languages. So for example, in the Middle East and North African region, we had a dialogue in English and Arabic. We also did the same for the Caribbean, and we also did in-person dialogues with indigenous communities in Peru and in Cameroon. We also did in-person dialogues with young people, both in India and in Nigeria. And the idea was to really combine the research that we wanted to do with lived experience insights. So people who have lived experience of mental health challenges in the context of climate change, and for research to be centered on their voices and their expertise. In each region, we had a regional organization, but we also had a lived experience advisor and a young person to advise the creation of this agenda, which represents what their region is, how is it being impacted in terms of mental health, and what are the actions that needs to be taken in terms of policy. And we also had a collection of case studies gathered, interventions that were led by the community or the governmental level, as well as lived experience stories. And one really amazing case study we had was in Jordan, where the regional organization was based in Jordan, and they took the agenda and they presented it to their Ministry of Health. And their Ministry of Health at first was very resistant to the idea of climate change and mental health. It is not a priority. But then after seeing the agenda, after seeing the priorities and the insights of the participants, they decided to open a department within the Ministry of Health that looks into mental health and climate change together with the Ministry of the Environment. So the last thing is the overall themes that we have seen around climate change and mental health, that there is a huge gap when it comes to data. And data is very important because it's very difficult to measure the impacts of climate change or to measure mental health data. So it's so important to gather that. There's also the lack of interdisciplinarity. So sectors need to come together and experts need to come together. And the importance of centering lived experience. Data is important, but also the voices and the insights of people is important. Community engagement is important. And to do that in a way, it is a process, having a sense of co-ownership and co-leadership and co-creation between the communities and the researchers is very important. And we wanted to do that in every step of the work that we did. And then finally, having platforms to not just elevate the impact, but elevate the interventions that are especially led by communities in Global South, and providing them with the funding needed to do the research, to do the grassroots action for climate change and mental health. And you can see all of these amazing lived experience advisors. Each one of them shared with us their climate experiences and how it affected their mental health, but also how it empowered them to lead climate action. And I will try to see if the review is going to work. Just the 1 minute is up.
People are tired. People are frustrated. Environmental problems are at the low end of the priority list.
I could not sleep at night. I had anxiety attack, I would say, because you're constantly worried. And also, even at work, I was angry because I'm like, there's no water.
In the capital of India, where I mean, the last couple of years, the summer temperatures have regularly been crossing 50 degrees Celsius, which is actually unheard of. It's unnatural.
I think indigenous identity is such a big part of our resilience. And when you take away the land and the forest that is that source of identity, that can lead to a lot of mental stresses as well.
We lived in a constant state of terror that it would spread. We were afraid to go outside. We had young kids.
Who you are, it not defines you to be a change maker for a better future of yourself and your community.
Yeah? You have to do it.
Click on the Zoom button at the bottom,
Yeah, okay.
and that'll bring the Zoom back up,
Yeah.
and then you should be able to get it.
So, and then my parents training.
Yes.
Yes, okay. Yep, I think this was the last slide anyway, the one before the last. But I just wanted to share with you that these are just snippets from the lived experience stories, and you can find all 25 of them on our global online hub. We also have all the research agendas that we have developed across all the 7 regions. And we also have a few toolkits for researchers who are interested in this specific intersection, for those who want to work with policymakers to either integrate climate change and mental health policy or vice versa, and also how to work and engage with lived experience communities. And I think this is the most important. We learned so much on how to engage those who are at the grassroots level. And there are also the case studies, which are really amazing. And we are now in the process of synthesizing all the regional research agenda into a global one. So we have a global benchmark for climate change and mental health, for research, for more research to be done, but also influencing policy, getting funders into the specific intersection. And lastly, this is one of my favorite quotes, and it gives me a lot of hope. It's by Mary Robinson. And she said, and she's actually got that quote from an Indigenous community leader, and what if our best times are ahead of us? And what if we were to choose and work for what's happening in the ground and making good to everything? So thank you all so much, and I look forward to your questions.